So we have to look at, future needs because, supply chain are as strong or as weak as, their weakest link.
Supply chain in healthcare is really been viewed prior to now as, a back office corporate function that we all just expect it's going to work, right? And the only time we think about it, sadly, is when it fails, a shortage, something doesn't come. And of course, all of that has changed.
We need to ramp up domestic manufacturing, whether that's from Canadian-based companies or from multinationals that are operating in Canada, and incentivize those investments.
There's a huge value in having a strong medtech industry in Canada. And there's something unique about Canada, which is we're the only country in the world that virtually controls all. The governments control vast, if not all, of the purchasing that's going on. Whereas when you look at it, healthcare is a huge part of our entire economy, and we've never made use of it.
We have to be thinking about the integration of our supply chain. And so I think we need to take a cue from the recent G20 conference where, some of the messaging coming out of that was how do international allies map each other's capabilities and expectations? And then what can Canada do in that conversation is meaningfully, I think, integrate into niches that we can win and have the right to compete and win in partnership with international allies.
We certainly need to do the unthinkable and actually have the provinces, territories, and the federal government work on this in a collaborative fashion. And this endless friction, the funk and the dysfunctional in our federation is absolutely maddening to watch. The supply chains are hugely international. We have to think about self-sufficiency, but also who our friends are to share those supply chains with. That requires the federal government to work with the provinces to get that done.
We need to bring all the players together on a regular basis. It can't just be these one-offs. It can't be a pilot project here. It can't be an initiative over there. We need to make this ingrained in our system that we're dialoguing on a regular basis. We're all working together.
COVID and the pandemic will lead to, we hope, a generation of healthcare innovation, including in Canada, and the government of Canada has to be a partner.